This is Crystal Fenn with MedPage Today. When the tobacco industry settled litigation with the states over marketing a product to children that it knew was harmful, it may have been laying the groundwork for a similar battle against the food industry. That's what I heard from anti-tobacco researcher and advocate Dr. Stanton Glantz, director of the UCSF Center for Tobacco Control Research and Education.
The more you look at the modern food industry, the more it looks like the tobacco industry. You see predatory marketing, you see design of products in a way to maximize profits at despite the adverse health impacts. And there's a lot of ideas that the obesity people are taking from this. Trying to tax high sugar products, menu labeling, trying to get rid of trans fats. There's a lot of public policy approaches that one could take that have worked successfully in tobacco and adapt them to obesity.
The CDC and other public health groups have such efforts underway to change the food environment through policy, but other moves out of the anti-tobacco playbook are also being seen.
There have been some attempts to sue the food companies over some of their predatory behavior. So far, that hasn't really gone anywhere. But it took a long time for those sorts of things to get going on tobacco and to get their legs. And so, what exactly happens in the litigation environment, which is what led to the master settlement agreement, I think that's too early to tell. There are definitely people thinking about it.
But if the fight against tobacco in the United States is any guide, it's not going to be a quick or easy battle with the food industry.
Another important lesson from the experience of the Master Settlement Agreement is that these big multinational tobacco companies didn't just sit on their haunches and let public health policies be put in place that were going to hurt their sales. And if you look at the places where the programs have been maintained, and even in a few places expanded, it's places where the public health community, groups like the American Heart Association, the American Cancer Society, the American Lung Association, the Academy of Pediatrics, other private advocacy groups have been willing to play hardball and force the politicians to maintain these programs, because the pro-tobacco forces are constantly running around in the shadows with their lobbyists, with their campaign contributions, giving these politicians excuses to cut these programs. And the lesson, I think, for other areas where health policy could improve health, such as obesity protection, such as reducing the amount of salt in the diet, it's going to take aggressive non-governmental actors to force the political process to keep honest.
So the state's victory against big tobacco may be guiding anti-obesity efforts targeting the food industry, though how far the food fight will go and who will win remains to be seen. I'm Crystal Fenn, MedPage Today.